This mandatory training module will introduce you to AIDET plus the Promise. This is the standard communication approach that should be used by all Bruyère staff, volunteers, learners, and physicians with every interaction. Throughout the next 12 minutes, you can expect to witness the impact of poor communication on patients and the workplace culture. You'll learn how to connect and communicate in an effective way with patients, residents, families, and colleagues using the AIDET framework, and you will experience the significant difference when AIDET is used. Finally, you'll find out what's next for you on the AIDET journey and how you can adopt the practice and make it your own. You are, after all, an essential part of the Bruyère experience.
Bonjour, hello, my name is Bruyère. I'm a volunteer at Bruyère. How may I help you, ma'am?
Hello, bonjour.
Welcome to Bruyère, Mrs. Smith. My name is Jessica. I'm the information clerk here. I'll just make sure which program you're going to today. I'll contact the staff who will be taking. Thank you for your patience. It'll be just 5 minutes.
Hello, Mrs. Smith. I'm from maintenance. Is it okay if I come in? Hello, Mrs. Smith. My name is Jean-Guy. I'm part of the maintenance staff here at Bruyère. My job is to keep the hospital well maintained and make you as comfortable as possible. I received a call from your kind nurse, Julia. She says the light's a little bit dim and might need replacing. Can I take 5 minutes to take a look at it and replace the light bulb?
I'm sorry, Mrs. Smith. It seems we're having a bit of trouble with our computer system, but don't worry. Our experts down in IT will get it all figured out in no time.
Helpdesk, bonjour. Hi, mon nom c'est Nicolas. Comment est-ce que je peux vous aider? How can I help you?
Hi, Nick. This is Kathy. I'm a nurse from Rehab 3. I'm here with a patient, and I'm having some problems with my computer. Would you be able to help me?
I see you here. I've seen this problem a few times. If you just give me your asset number, I'll take control of the computer and get you back in action in about 5 to 10 minutes. Thank you so much for calling us, Kathy, and letting us know about the issue. I'm at extension 1234 if anything comes up in the meantime.
Thanks, Nick. Our computer experts are working to fix the problem and say it should be only about 5 to 10 minutes. Is there anything else I can help you with right now?
Good morning, Mrs. Smith. I'm Dr. McGuire. How are you this morning? Mind if we chat for a little bit? I'm the Chief of Staff. I'm covering for the weekend. I've been working around here about 30 years or so. And what I'd like to do is, because you're going home on the weekend, I just want to sit down and chat for the next few minutes about what it is you'll need to do when you get home and what sort of things to watch for. Have things set up for you and arranged for you so that things are as comfortable as possible when you get home. Take all that with you, and those are the general things that we need for you to do after you go home. Do you have any questions about any of that? That's pretty normal, because I come in and I sort of give you a whole pile of information and then off I go, and then 5 minutes later you go, I have a question. Yeah. If that happens, just ask for somebody to come back and we'll explain. Okay? Anything else I can do for you this morning? Well, thank you for coming to stay with us, and it's been nice to meet you. You have a good day.
Why AIDET? The impact of poor communication in healthcare can have dire consequences. On the contrary, well-framed, purposeful communication can have significant effect on positive outcomes for patients and their families and improve patient experience all around. Why now? AIDET, when utilized by everyone with every interaction, is a proven tool that will help us to achieve our goal of being recognized as a national leader in the delivery of quality care. AIDET is proven to work. It improves patients' and customers' perception of their care or service. It reduces patient anxiety. It improves clinical outcomes and compliance with treatment. It improves workplace relationships. It increases provider satisfaction and ensures that all service providers are delivering consistent measures of empathy, concern, and appreciation. AIDET is based on a set of objectives and is not a script. Actually, many of us already use most of the elements in our regular interactions, but with AIDET we want to ensure we're covering all of our bases and meeting the AIDET objectives. We should also keep in mind that although AIDET is the acronym, it's not order specific, and sometimes it just doesn't make sense to use all of the elements, especially when you're already familiar with the person you're speaking with. A stands for acknowledge. We must acknowledge our patients and colleagues to increase safety and preserve dignity. Knock before entering a room. Greet everyone with a smile, even over the phone. And don't forget the 10-5 rule. In public places, when you're walking by somebody, at 10 feet, make eye contact. At 5 feet, use a verbal greeting, like hello or bonjour. I stands for introduce. We can introduce ourselves to help build trust. Make sure you say your name, your department, your role, and use this opportunity to make the patient feel at ease by managing yourself and your team up and describing your experience, special skills, or things that will make your care unique. D stands for duration. Give a duration to help decrease anxiety. You can describe how long the test, procedure, wait, or encounter will take. You'll want to be specific with the time increments, and if you don't have a specific time, you should commit to a specific interval in which you will update the person you're speaking with. E stands for explanation. We should explain step by step what's going to happen in plain language. When explaining, try to answer the why, what, how, and the risks and benefits of a specific treatment or procedure. Narrating your care or service is another great way to keep our patients and residents informed. Remember, explaining is always important, and it's especially important when you need to be certain the person you're speaking with fully understands what you're saying. For example, when you're seeking informed consent from a patient. T stands for thank you. It's always important to show genuine appreciation. Let patients know that you've enjoyed caring for them, and let colleagues know that you appreciate being able to help them. Everyone appreciates feeling valued. In standardizing the use of AIDET at Bruyère with every interaction, together we can reach our goal of becoming a national leader in the delivery of quality care. Finally, your AIDET call to action. At Bruyère, our goal is that AIDET will be used in every interaction with patients, colleagues, and partners as of January 2020. Your next steps. Start using AIDET now. Your leaders and some of your colleagues have been trained to use AIDET and will be able to coach you while you get familiar with this effective method of communication. Personalize your AIDET. Download and complete the worksheet in the resources section of this video if you're accessing it using our learning management system. Or you can search for Together We Can on InfoNet to build your personalized AIDET. Take part in a short face-to-face training session where you can practice your AIDET skills. These will be held on all units and on all shifts after the initial release of this module, and will be provided at general orientation on an ongoing basis. You can access all of your AIDET resources by searching Together We Can on InfoNet. Remember that practice makes progress. We're all learning together. Thank you for taking the time to watch this video and for your continued efforts in improving the Bruyère experience.